Welcome back, everybody, to Dr. Sellers Educate. We're excited that you're back to continue to support you on your journey. In the Snapshot series, we have been focusing on exam analysis from A to Z. What is it that you need to know to prepare and to be successful on the C&E exam? We are going to continue to use our resource, which is Billings and Halstead, as our primary text, Teaching and Nursing, the 6th edition. And if you have Dr. Caputi's C&E review book, the 2nd edition, you can pull out that resource as well. All right, so in this episode, we're going to be talking specifically about F and G. F stands for fairness, taking a look at those 3 key steps that we should ensure we're following to provide a fair exam where we are truly assessing the knowledge and the competency of our students and related to the content that we have covered in our course. And then G is for guidelines for writing test questions. What is it that you want to make sure you know, and what gaps are you closing to get ready for the C&E exam? Now, as excited as we are when we hear that you have passed the C&E exam, we are equally excited when we hear that we have helped you be a better nurse educator in the classroom. Ultimately, that is what our mission is all about. It is twofold: to help you be successful on the exam or to maintain your certification. And then second of all, to help you be a better nurse educator, equipping you with skills, knowledge, and ability to engage in the learning process with our students and with our learners to help them close their knowledge gaps and to be competent in the clinical setting. Go ahead and pull out Billings and Halstead. We're taking a look at our resource on page 478, box 25.1. This is where you're going to see some specific guidelines for writing test questions that we're going to be further exploring in our time together today. And then for Dr. Caputi's review book, it will be chapter 3. First, we're going to take a look at what are those 3 key steps to ensure that we are providing fair exams where we're evaluating and really validating that learning has happened. First is to clearly communicate expectations and guidelines, including this information in our syllabus from the very beginning of our course, to talk to students about how many questions will be on the exam, when those exams will be given, if we can provide a learning guide. These are all great strategies to help decrease the bias and to promote the fairness of an exam. Second is to provide equal access to necessary resources if a textbook is required, if a literature article is required, ensuring that we're giving our students the information that they need to review those resources so they can have firsthand account of that content, reviewing the content, just like we do here at Dr. Sellers Educate, to help them close their knowledge gaps. And then number 3, ensuring that the assessment, the tools that we're using to evaluate that learning has happened, that they accurately measure and are mapped back to those learning objectives. Next, let's talk a little bit about clear and transparent exam guidelines. First is to let students know, what is that exam format? Is it going to be multiple choice? Are there going to be fill in the blank questions? Is it an essay or short answer? This is going to help our students better prepare for the exam. Second of all is proctoring. We want to make sure that we do have appropriate proctoring of the exam to allow us to support the academic integrity policy. A best practice is also to make sure that students are signing their commitment to maintaining academic integrity when it comes to taking the exam. Let's take a look at our thought-provoking question. We always like to provide a question that is going to help you think about content related to the various competencies and domains that we are exploring. So our question is, when developing nursing exam questions, what should be considered to ensure fairness and to minimize bias? So we have 4 choices. A is personal preferences of the question writer. C is cultural and ethnic diversity of the test takers. C is the difficulty level of the question. And D is the availability of reference materials. Okay, so if you want to pause here and come back when you're ready, that is fine. We're going to keep going with our content. Next, let's talk a little bit about the appropriate exam length and difficulty level. So thinking about the number of questions on our exam really is going to help better inform us with how many questions we should include. And then same thing with difficulty level. We want to make sure that we are leveling the questions on our exam, the difficulty level as we think about Bloom's taxonomy. I'm starting on page 188 in your Billings and Halstead textbook is where you're going to see some information about the different levels of Bloom's taxonomy for the cognitive learning domain. All right, so we want to have a variety of difficulty. We don't want it to be too difficult. We don't want it to be too easy. And based on our previous review on our journey in looking at item analysis and exam analysis A to Z, we know that the p-value is what tells us in our statistical report of the difficulty level of the exam. Next is to make sure we're providing clear instructions. We want to remove as many grammatical errors as possible, and we want to provide very succinct, detailed instructions so that our students have a clear understanding of how to actually take the exam. All right, and then third is to make sure we are using unbiased and relevant questions. All right, and we're going to dig into some of those best practices when we take a look at box 25.1. Next, let's explore what we mean by proper and standardized grading procedures. We want to be clear about how the exam will be graded. As an example, if there are 50 questions and 25 of those will count for 1 point and the other 25 will count for 2 points, or if there's any variability in the weighting of questions, we want to be clear with our students about what that is. I'm giving clear rubrics so students can understand how they will be evaluated for their knowledge and which specific content each component of the grading rubric will map back to. Okay, so thinking about best practices of a rubric, there are 3 elements. First is we want to have details about exactly what's been evaluated. Second, we want to include how many points are allocated for that specific rubric. And then number 3 is to break down good, better, and best, if you will, when it comes to how students will be graded for the content that they include. Next is to address any biases or discrepancies. The more we're able to remove those, asking a peer to take a look at our questions or the evaluation tool to ensure that we're not being limited in our evaluation of removing those biases. And then accommodations. We know that our standard practice is to refer our students to the Office of Disabilities or Office of Accommodations, whatever that office is called at your university. Those are the individuals that have the expertise and the knowledge to be able to make those decisions. Once that office gives us the accommodations direction, then we follow through on that by allowing for extra time, alternative formats, assistive technology, or accessible locations. Whatever those accommodations are is what we want to make sure that we follow. And then to wrap up regarding fairness, it is all about ensuring that we have done our part to remove these biases, providing clear directions, offering those accommodations so that we can feel really good about the quality of the evaluation tool that we have used to validate knowledge. And then next, as we close out, we're looking at G, which stands for guidelines for writing those effective test questions. So let's go ahead and take a look together at box 25.1. Some key components under scenario says that we should include a single realistic clinical encounter. Now, sometimes we can feel compelled to include a lot of details in our scenarios or our case studies. That is not a best practice. Again, we want to start, especially if we're doing an unfolding case study, with a single realistic clinical encounter. Another point we want to cover or bring to your attention under scenario is to include cues about the environment or setting, such as setting priorities or including relevant data, such as lab work, perhaps vital signs, just to make sure that we are giving students adequate information for them to make decisions about a scenario or a case study. We should avoid using names for the scenarios, and we should only include information about gender, ethnicity, race, or clinical setting if it is important for that specific scenario. All right, and then taking a look at STEM, a couple of key points here is they should be clear enough to answer without looking at the options. We should avoid using clue words in the STEM. I know that can be a little bit of a challenge. And then third point we want to pull out is that we should write the stem using our active voice. Lastly, correct and incorrect answers. 3 key reminders is to keep the answers the same length, because if we have an answer that's longer and it happens to be the correct one, that can be a little bit of a giveaway. So we want to avoid that. All answers must be realistic or possible as a possibility or plausible. And then third is to keep all options grammatically consistent with the stem to avoid giving clues to the correct answer. All right. So again, this is on page 478 in Billings and Halstead. So why are test questions important? Well, they simply help us evaluate and assess if learning has happened. Also gives us feedback because we would have done a really good job of developing a solid exam blueprint that maps content to the questions and the learning objectives. It gives us feedback about our ability to provide a valid and reliable exam for our students to really evaluate that knowledge. Remembering that well-crafted or well-designed questions are always clear, concise, and they measure a specific learning objective. Again, going back to the mapping as a best practice. What are the types of test questions? On page 478, this is where, in Billings and Halstead, this is where it begins to talk a little bit about the details regarding each type of question and the benefit, the pros and the cons, because each type of question has it. We have multiple choice questions, which specifically test recognition and recall. True false questions test recognition. And then our essay questions are the ones that really dig deep into the evaluation of comprehension and application. Some general tips for writing test questions. We know that writing really good test questions is an art and a science, and it takes skill. It takes a lot of development and practice. We want to be clear and concise in our language. We want to avoid using double negatives, which can be a challenge for many of us. And we want to make sure that we avoid using irrelevant or misleading information in the question stem. All right, so we want to keep a focus on the content of the question. If you chose B, cultural and ethnic diversity of the test takers for our thought-provoking question, you are correct, and give yourselves a round of applause. This is going to include our snapshot for this episode. We are excited to hopefully see some of you on Tuesday. This is when we will have our webinar comparing the old exam blueprint for the CNE and the newly revised blueprint that has just been released by NLN. We hope to see you there, and you can find those details right here in our YouTube episode. Until next time, have a great one, everybody. Bye-bye.